Let's talk about hiccup. Why hiccup occurs? You have to understand the reflex pathway of hiccup to understand why it occurs. So, afferent fibers pick up impulses from the diaphragm, from the pharynx, from the larynx, from esophagus, from stomach, from the viscera in the thoracic cavity, abdominal cavity. If there is any irritation, those irritation is picked up by afferent fibers, and that information goes to the brainstem, to the lateral medulla, also to the hypothalamus, and from there efferent fibers send impulses via phrenic nerve to the diaphragm, and other efferent fibers goes to the glottis. So when diaphragmatic irritation occurs and brainstem fires efferent impulses, then diaphragm suddenly contracts. So when there is sudden involuntary contraction of the diaphragm, a gush of air goes inside lung. So diaphragm contracts, air goes inside, and to prevent further ingoing air, glottis closure occurs. So when glottis closure occurs, there is a hic sound. So when there is a gush of air, why does there is sudden closure of the glottis? To prevent further ingress of air, because normally we are inspiring and we are able to maintain oxygenation, we are able to wash out our carbon dioxide, but in between, if there is diaphragmatic contraction and we inhale more air, that will cause hyperpnea, tachypnea, that will cause hypocapnia, that will wash out carbon dioxide further. We are still able to maintain oxygenation with normal diaphragmatic contraction, with normal inspiration. That's why when sudden gush of air goes inside, glottis closure occurs suddenly, because the brain says don't take much air, because he will go into hypocapnia because of hyperventilation. So this is a reflex pathway. So as I previously talked, that the irritation is not only from diaphragm, but it can be picked up from other viscera as well, like in pharyngitis, laryngitis. Impulses are also picked by vagus nerve from here, or if there is esophagitis, peptic ulcer disease, then impulses by vagus nerve is also picked up from those body organs, but commonly it occurs due to diaphragmatic irritation than other causes. So why diaphragm is irritated? So it is not that both diaphragm, right and left, are irritated simultaneously. Generally, it is one of the diaphragm that is irritated and one of the diaphragm that contracts with sudden force, and generally 80% of the time it is left side of the diaphragm. So I am talking about common causes. So when stomach is over distended due to either overeating or swallowing a gulp of air while chewing gums, or when we drink carbonated beverage that produces carbon dioxide inside our stomach, that distends the stomach and irritates the left diaphragm. Also, gastroesophageal reflux disease, peptic ulcer disease, this can also cause hiccup. So generally left sided diaphragm is involved, but right sided can also be involved, like in hepatitis, hepatomegaly. Right diaphragm irritates. In gallbladder disease, right diaphragm irritates. And I missed one cause, stomach cancer. When there is stomach cancer, then also there can be distension of the stomach due to gastric outlet obstruction, and that can also irritate the left diaphragm. But other intra-abdominal pathologies like pancreatitis, pancreatic cancer can also cause hiccup, because vagus nerve innervates abdominal viscera, and irritation from those abdominal viscera are picked up by vagus nerve and goes to the brainstem, that produces hiccup. So is this beneficial? In human body, whatever response our body generates generally is beneficial, right? For example, when we have fever in response to infection, why does fever occurs? To generate high temperature to kill bacteria. We do not feel like eating when we have any illness. Our mouth becomes bitter, we do not have appetite. That has a reason, because it generates a state of autophagy. If you do not eat, then in autophagy, that bacteria can be digested by our cellular organelles. So to kill the bacteria, there is decreased appetite. So if any reflex process occurs in our body due to any illness, that has a reason for our benefit. But is this hiccup beneficial? No. That's why we need to avoid it. It is not beneficial. Actually, this is a ruminant that is present in mammals. Actually, this was the mode of respiration, breathing in amphibians. If you read the literature, you will find that amphibians used to breathe with hiccup. So this is a ruminant that is present in us mammals. It is not for any benefit. That's why we need to avoid it. So we were talking that This can occur due to any pathology in the abdominal cavity. Similarly, pathology in thoracic cavity like pericarditis, myocardial infarction, bronchitis. These can also irritate vagus nerve. Similarly, if there is compression of the esophagus with intrathoracic lymph nodes, or if there are cervical lymph nodes that is compressing oropharynx, that can also irritate vagus nerve and produce hiccup. So these are peripheral pathologies. Now let's go to central nervous system pathology that can produce hiccup. So one is stroke, lateral medullary infarction, CNS neoplasm, brain abscess, encephalitis. These are some of the CNS causes that can cause hiccup. Another common cause is stress and anxiety. When there is acute onset of any psychological distress, that can also produce hiccup. So when any patient present to us in our OPD with hiccup, first of all I ask, for how long are you having this? If this is going on for less than 48 hours, it means that it is a benign cause and it will resolve. But if this is persistent for long duration, it means that we need to work up this. We need to find out etiology in addition to aborting his hiccup. So how to abort the attack of hiccup? So I'd like to now talk some of the physical maneuvers, and these maneuvers are based on stimulation of vagus nerve, stimulation of phrenic nerve. So if that vagus nerve is already stimulated, then why we are hyper stimulating it? Or if phrenic nerve is already stimulated, why we are hyper stimulating it? So hyper stimulating the nerves produces a period of latency. So when any nerve goes sudden firing, and when you hyper fire it, then after that it becomes refractory to further firing. That's why we hyper stimulate vagus nerve. So some of the maneuvers to stimulate vagus nerve is gently pressing eyeball. This stimulates vagus nerve, or doing Valsalva maneuver for 10 seconds. This stimulates vagus nerve. Or when you press ear inside the ear for 10 seconds, this also stimulates vagus nerve. And how to stimulate phrenic nerve? Look what I am doing. What I did, I took 3 inspiration in a row. First, second, third. So this is hyper stimulating phrenic nerve. So this maneuver also abrogates hiccup. Another maneuvers are chewing lemon, chewing ice cubes, chewing crystallized sugar. This also stimulates vagus nerve. Initially, if you have listened my talk carefully, I told you that hypocapnia induces hiccup. To prevent hypocapnia, I told you that glottis closure occurs. So hypocapnia induces hiccup, and hypercapnia abrogates it. So how can we induce a state of hypercapnia in your body? Hold your breath as much as you can. Hold for 10 seconds. So carbon dioxide builds up, and hypercapnia also terminates hiccup. So these are some of the common maneuvers I try in my office, and I also advise patients to do these when they have attack of hiccup. If you know further maneuvers, you can also comment it down so that we can learn. And if these maneuvers are not helping, then I prescribe treatment depending upon the suspected etiology. If I suspect patient is having GERD, acid peptic disease, or problem might due to stomach distension, then I give treatment according to that, like PPI, antacids. And generally I give antacids containing local anesthetics. That local anesthetic blunts the picking of impulses from the gastric mucosa by the vagus nerve. So if antacids containing local anesthetic is more effective, and if it is due to bloating, flatulence, if hiccup is due to that, then we can give simethicone. This is available in syrup, that helps. But if you think that CNS pathology is causing his hiccup, then we can try gabapentin, baclofen. Baclofen is muscle relaxant. It relaxes diaphragm. If you suspect that diaphragmatic contraction is causing hiccup, then relax diaphragm with baclofen. Similarly, another drug is metoclopramide, which is dopamine blocker, D2 blocker, which is a prokinetic. So if you think that there is gastric distension and GI cause that is causing hiccup, then we can try prokinetic. Similarly, chlorpromazine, this is also D2 blocker and has some prokinetic effect. So we reserve chlorpromazine if other medications do not help. Initially, in olden days, more than 20 decades ago, when we do not have good amount of drugs, then we used to try chlorpromazine as a first line drug. But now we reserve it as a last line drug when other drugs do not help. So these are some of the drugs to treat a broad acute attack of hiccup. Now let's talk some of the interventions. So our interventions are designed to stimulate the vagus, stimulate the phrenic nerve. With electrical stimulation, we stimulate vagus nerve, phrenic nerve, or either block the phrenic nerve. So we stimulate with electrodes, external electrodes placed internally, surgically, or we can block the phrenic nerve. Here we can inject local anesthetics and block phrenic nerve. But if you block phrenic nerve, you know the consequences. There can be ventilatory insufficiency. So we resolve it when other measures do not help.